Today's video, we will cover sensory visual disorders. At the end of the video, your completed map should look like this. So let's get started with our blank map so that you can follow along. Let's begin with a quick review of anatomy and physiology. There are three essential parts to vision. The retina is sensitive to light and it triggers impulses to be sent to the optic nerve. The optic nerve then transmits that information from the retina to the brain for processing. The macula is in the center of the retina and it's responsible for central vision and high acuity or detail vision. Let's talk a little bit about general manifestations of a visual impairment. They would include things such as squinting, maybe academic difficulties, headaches, eye rubbing, tearing or drainage, pain. You might even notice that the eyes are not aligned. Also, we might notice a change in visual acuity, maybe blurry vision or a decrease in visual acuity. As a reminder, we really do not achieve 20/20 vision until somewhere about 6 to 8 years of age. In fact, a preschooler has acceptable vision at 20/40. Sometimes you'll hear something called legal blindness. Legal blindness is defined as vision 20/200 with correction. So if you have 20/200 without correction, but you can be corrected or have glasses that help you see better than 20/200, then you would not be legally blind. So someone who's legally blind can only see 20/200 or even worse with all the correction that's possible. Now let's start talking about our disorders. And the first one we'll talk about is infection or inflammation, commonly called conjunctivitis. This is not uncommon to see. It usually presents with maybe red sclera, maybe red conjunctiva, or some type of drainage. You see on this picture here, that's a good look at the lower conjunctiva being reddened and the sclera being reddened from some type of conjunctivitis. Now, you can have allergic conjunctivitis, viral conjunctivitis, or bacterial conjunctivitis, which is commonly known as pink eye. Usually, these things cause itching and possibly even pain with that drainage. Now, allergic conjunctivitis would be maybe during allergy season or when you're being exposed to an allergen. It usually affects both eyes, and it's usually clear drainage. Viral conjunctivitis can be 1 or 2 eyes, and again, clear drainage. Pink eye or bacterial conjunctivitis often just starts with one eye It may spread to the other if you contaminate. And you usually see yellow-green drainage. You would benefit from antibiotic eye drops with bacterial conjunctivitis. There's one cancer I'd like to talk to with regard to the eye, and that's retinoblastoma. And that's a cancerous tumor of the eye. As far as identifying retinoblastoma, it usually affects infants or young children. And how you would identify it is during a red reflex test. The red reflex test will actually, instead of appearing red, will appear white. So instead of seeing a red eye on maybe a photograph or when you shine the light to get the red reflex, you would actually see a white reflex. Prognosis is generally good for retinoblastoma, except there usually is loss of that eye. Let's move on to some other disorders. We'll talk about eye movement disorders or disorders of the eye muscles. The first is strabismus, and strabismus is misalignment of the eyes. In strabismus, you can have what we call an esotropia, which it means the eye is turned inward, or an exotropia, where the eye is actually turned more outward. You can screen for this using a corneal light reflex. When you flash the pen light, the reflection on the pupils will be in different locations, and that will tell you that the eyes are not aligned. You can actually see this on this picture below. You can see that this one reflex on that one eye is not on center. The second problem is amblyopia, which is often called lazy eye. This is where the eye and the brain are not working together. You actually have one eye that wanders around to the side, and it wanders when it's not used. You can screen for this using the cover-uncover test. And usually when you uncover, you can quickly catch that eye wandering. In both cases, these can be treated with either patching or dilating the good eye to make the bad eye work harder. If that doesn't work, then you might need surgical intervention. Let's move on to errors of refraction, or the need for glasses. We've got a couple to talk about, the first of which is myopia. Myopia is referred to nearsightedness, which means you can see near. Can't really see far, but you can see near very well. In this particular case, the lens is more of a concave shape. In hyperopia, that's called farsightedness, meaning you can see far. The lens is more of a convex shape. This becomes important when we put on glasses. When the glasses are made for the individual, they'll assume the opposite shape to kind of make up for either the concave or the convex shape of the lens. Now, astigmatism is an irregular curve. With an astigmatism, it's actually a little bit harder to get glasses for this case because the curve is irregular. So those glasses tend to be a little bit more expensive and a little bit different in nature. Our last one is presbyopia. Presbyopia is the loss of accommodation as we age. As we get older, our eyes do not adjust as well. They cannot move from near to far vision very quickly. It takes more time for them to accommodate. Usually, people become farsighted, which means they need reading glasses. But that's not always the case. Now let's talk about visual disorders. We're going to talk about 5. The first of which is glaucoma, and there are 2 types of glaucoma, chronic and acute. With glaucoma, it is the development of increased intraocular pressure that presses on the optic nerve. This increased pressure, as it presses on the optic nerve, it actually can damage the optic nerve irreversibly. So once vision is lost due to glaucoma, you can't get it back. Usually what happens is individuals lose peripheral vision. And they actually start to develop more of a narrowing of their visual field as the pressure damages more and more of the optic nerve. Now there are 2 types. The first is chronic open angle. That is the most common. And that tends to develop as we age. It's more of an insidious development. You kind of don't know it's happened. And for the most part, it may not be painful. Individuals may start to complain of visual changes, however. It can be treated with eye drops, but any visual loss that has occurred cannot be reversed. The other is acute closed angle. This has a sudden onset, and it's emergent, and it's very painful. In this particular situation, acute closed angle is less common. In both situations of glaucoma, basically what's going on is the fluid in the eye, called the aqueous humor, is not draining properly, and that increased pressure starts to damage the optic nerve. Now let's talk a little bit about cataracts. This is another fairly common eye disorder. Cataracts are a clouding of the lens. And again, this tends to occur more often as we age. You can see this picture here shows a clouding of the lens, and you actually see where it's more of a white reflex because the lens has been clouded. Although most cataracts develop later in life, you could be born with congenital cataracts. Risk factors for developing cataracts are age, as we get older, sun exposure, that's why it's important to wear your sunglasses, and diabetes. Patients often complain about blurry vision, or they have a lot of problems in the sunlight. What happens in the sunlight is you get a refracting of images off that clouded lens. So what you tend to see is people wearing very dark sunglasses who have cataracts to minimize this light refracting. If a cataract is present, you may not see the red reflex, but you'll rather see a white reflex. Surgical lens placement is the common treatment. Our next is diabetic retinopathy, and this is common in diabetics as they age or in diabetics with poor blood sugar control. So what happens is as our blood sugar is higher, it leads to the tiny vessels in the retina leaking and bleeding. The high blood sugar tends to make those vessels weak, and then they start to leak and bleed, and they develop scar tissue. Visual loss and blurry vision will develop as that scar tissue increases. Now, sometimes you can do laser surgery to help remove some of that scar tissue as a treatment, but really the best way is to prevent the development by having tight blood sugar control. So it's important for diabetics lifelong to maintain that good blood sugar control so that they don't develop these weakened vessels in their retina. The next thing we'll talk about is macular degeneration. It's another common disorder of aging. Macular degeneration is the progressive loss of central vision due to the degeneration of the macula from oxidative stress or some type of ongoing inflammation. So we see this loss of central vision. And it's due to oxidative stress, inflammation, and aging. Patients start to develop distorted central vision, and this may be identified with something called an Amsler graph. With an Amsler graph, it's actually a graph of lines. And a normal patient will see the lines straight. But in a patient with macular degeneration, the lines become wavy in the center and distorted. Now, there are two types of macular degeneration, wet and dry. And dry is the most common form. Dry is the development of yellow protein deposits called drusen spots, and these will affect the central vision. The wet is less common, and it's actually caused by proliferation or overgrowth of blood vessels that start to leak and ooze. The last disorder I want to briefly talk about is retinal detachment. This is an emergent eye condition due to trauma. So if someone is hit in the eye, they could suffer from a retinal detachment. What happens is a layer of the retina tears away. Patients may actually describe it as a loss of vision from the top down, or maybe a veil coming down on their vision. And that's as that retina starts to detach and pull away. They may also have flashers or floaters or some other type of visual change. Surgical intervention is often indicated. And so here you go. Here's your completed sensory visual map. Remember, if you enjoyed learning from the video, please like and subscribe to our channel. If you want to purchase the maps, you can go to the Etsy site.